Good afternoon, and thanks for joining us for today's Healthline. I'm Shannon Brinius, and on Healthline 3, we like to focus on ways to live a healthier, happier, and pain-free life. We're going to be taking your calls and answering your questions live in the studio today, and we'll be opening the phone lines in about 5 minutes. And as a reminder, we give these reminders every time we do this. Make sure that you are in a quiet room when you make your call and place it with the TV turned all the way down, and that way we don't get any interference. Our number is 318-219-4569. And today's topic, we are talking with Dr. Shane Barton, who's with Willis Knighton Orthopaedics and Sports Medicine, and we are talking about how to basically make sure that you get through a pain-free life when it comes to your bones and joints, right?
That's exactly right. And that's the goal of orthopedics, which matches the goal of Healthline 3.
Sure.
That people can have a very active and as pain-free as possible life.
And shoulders and knees, some of the joints that take the heaviest hitting, they're the areas that we're looking at in terms of injuries, right?
Yeah, you know, my specialty is sports medicine. That involves shoulder, elbow, knee. We do a lot of spine, non-operative things, ankles, hips, but really my specialty is shoulder, elbow, knee.
Okay, yeah. And so what are the most common sort of injuries that people would see in everyday life?
Yeah, you know, one of the number one things that come in, I mean, obviously trauma is a big thing, and it can be related to car wrecks, it can be falls, it can be slips, it can be accidents on four-wheelers, it can be collisions during sports. Those are kind of separate where people are forced to go in. The most common things we see that are more elective where people call are aches and pains of joints that are preventing them from doing what they want. And something like the shoulder. You know, someone paints their house over a weekend and the next week can't lift their arm and it stays bothering them, it keeps bothering them. We get a lot of calls like that.
And we've heard it before, you know, no pain, no gain, you know, shrug it off, go take a warm shower or hot bath or something. And would you say there's a point where you shouldn't be pushing through the pain?
Absolutely. You know, that we still want people to understand it's okay to have some soreness after activities, but if you're having pain that is limiting your ability to do what you need to do, either work or play or your recreational activities, and that continues, and it kind of depends on the severity. If it's severe pain that continues for a few days, that probably needs to be checked. If it's more of a moderate pain that continues for, you know, weeks or months, that also should be checked.
All right, so how do you know and how do you evaluate whether that pain, say for the knee, whether it's something that is going to require a more intensive intervention?
Well, a lot of it depends on the history. And I always tell people that the pains and the things that we see most common in our office are more related to time, as in people doing the same activities over and over, getting older, more related to time than trauma. Okay. And so when someone comes in, we can really talk to them and say, look, I was doing great. I twisted my knee. It became hugely swollen and I can't walk on it. That's something that you know right away. This needs to be investigated further. But a lot of people will come in and say, you know, Dr. Barton, I almost didn't come. My shoulder's been hurting me for a year. I just thought I'd get it checked out. And sometimes those things you can start very conservatively with management with things like activity modification, therapy, physical therapy, anti-inflammatories, or even injections.
All right. Now, we were talking about knees, but let's talk about shoulders,
yeah.
Rotator cuffs. Those are something that we've heard about, those tears in your rotator cuffs. Can you explain what that is?
Sure. If you look at what the rotator cuff is, the shoulder is a ball and socket joint, just like the hip. But the thing about the shoulder, if you look at the ball and socket, the socket is very shallow. And that allows the shoulder to have a great range of motion, more than the hip, but it also will allow it to be a little bit unstable. One of the things that we can do to strengthen that is strengthen our rotator cuff will provide increased stability. What the rotator cuff is the muscles on the front, top, and back of your shoulder blade. Those muscles turn into tendons and attach to the ball. And so that's a great way, you know, the condition of your rotator cuff is really the condition of your shoulder.
So lifting weights or pulling weights or something like that?
Yeah, those kind of things can be very good. You know, a lot of people especially people who are really trying to get back into activity. They'll overdo it with things like bench press or heavy overhead. You know, for strengthening the rotator cuffs, even professional athletes will use 1 or 3 to 5 pound weights with very specific motions that help strengthen the very small muscles that make up the rotator cuff.
You talked about people who are maybe just getting back into activity. Who is most at risk for rotator cuff tears?
Well, you know, young people, even if they have some traumatic event, they dislocate, meaning the ball and sockets slip out of place, the chance of them tearing the rotator cuff is very low. It's not zero, but it's very low. Once you're in your 40s or older, the chances go up significantly that you're going to have some sort of injury to your rotator cuff. If you think of the rotator cuff tendon, it's a little bit like a rope. You know, it's a flat sheet, but if you think of it like a rope that's being rubbed or used all the time, eventually that rope can start to fray and break down. You can either have a very sharp tear, which occurs with maybe a fall, or you can have a chronic rubbing where you actually erode the tendon. And so the mechanism of injury can vary depending on, you know, how long they've had symptoms.
And so treatment would vary as well, I'm sure, depending on the kind of tear you have. What distinguishes an injury that's so severe that you need to actually be looking at surgery?
It really boils down to the acuity, okay? I tell people there's 2 main reasons to have surgery, and none of them involve what the x-ray looks like or the MRI looks like. The 2 main reasons, number 1 is pain. And it's pain that's keeping you from doing the things that you like. And number 2, the second reason for surgery would be function. So, you know, some people will have pain, but their function will still be okay. And if you can manage that pain, they do well. Other people will have no pain, but they've lost function. And so that also requires evaluation.
Let's talk more about the recovery from rotator cuff injuries and treatment.
Yeah, so, you know, again, some people, if they have a chronic problem, we can often manage that. Just because you have a rotator cuff tendon tear doesn't mean you have to have a surgery. Many people, if it's a chronic tear that's occurred very slowly over the years, a lot of people are able to continue to do all the activities they want. They have occasional pain. That we can often manage with anti-inflammatory medicines, the injections of cortisone or steroid injections I was talking about. It just really decrease the pain. As opposed to someone who, say, is 35, they're working on an oil rig, and they fall and injure their shoulder, and then they can't lift it. That's much more serious and probably needs more aggressive treatment.
We hear a lot about age-related injuries. Tell us about those.
Yeah, the biggest thing, you know, some of the biggest things that we see, obviously, arthritis of the joints. We often will have patients that will suffer from an injury when they were young. It changes the mechanics of the joint, and then over time that joint begins to have wear and tear, and that's arthritis. That's one of the main things in orthopedic surgery we see that's as time related. Other things can be the degenerative rotator cuff tears. It can be you know, weakening of the tendons in the knee, okay, things like that.
And so when we're talking about that, and we do want to tell everyone, our phone lines are open. Give my voice a rest, please. Please call in 318-219-4569. We'd love to get your questions for Dr. Shane Barton. But when we talk about these, as more and more people are aging, if someone tears their, for instance, ACL, what do they do next?
Well, even ACL tears, you know, the ACL stands for anterior cruciate ligament, and the knee, that's, with young people especially, that's one of our most common injuries we'll see, especially during seasons that involve cutting and pivoting sports, things like football, soccer, basketball. Most often, about 80% of those injuries are actually non-contact. People think, oh, you got hit and you tore your ACL. Many of these are non-contact. Someone plants their foot to turn, feels a pop, and it goes out. Most young people that have an acute injury like that with an ACL, to be able to get back are going to require a surgery. Not everyone. Really, it's based on the stability of the knee, but most people that are young that have that tear will need it. But let's say you're a 60-year-old golfer. You're getting out of the sand one time, and you sprain your knee. You come in, you've got a bit of an ACL, but you say, look, doc, I'm able to do things now. My knee doesn't feel unstable. We can sometimes manage that without surgery.
And I know surgery is a wonderful gift that we've been given as a modern society, but it's not without complications, and people do want to avoid it. So what would that look like?
Yeah, and I think that's where your relationship with your healthcare provider is so critical. I tell people when you're selecting any physician, but specifically for us, an orthopedic surgeon, you really want to make sure you've got a team of people that you can trust, that you can get your questions answered, people that will spend time with you. Because I tell people when they walk in, I often will tell people, because they come in expecting surgery. And I'll tell people, I'm a surgeon, I love to operate. And if you need surgery, I'm glad to do it, but not everyone has to have a surgery. We might be able to make this better. And as long as they trust you and know that they can depend on you and your team to help take care of them, that's a good way to work with patients.
And certainly when people are coming in to see you, what are the best ways that you tell them to protect your knees?
Yeah, there's really three big things that I think are critical for everyone. Number one is just to stay as active as you can. We talk about motion our movement is medicine. There's an entire online group of exercises called Movement is Medicine. Another thing is motion is lotion, okay? It keeps your joints fluid. So I think staying active is very important. Number two, watching your weight. Weight is a huge thing, especially for chronic injuries. The wear and tear on the joints is tremendous. We can talk about it later if it comes up with the new weight loss drugs, the GLP-1s and things like that, and the impact that's already had on orthopedic surgery. And then the number three thing is strength. We used to talk about, stay active, watch your weight, but we also now, especially as you age, the importance of resistance exercising and maintaining muscular strength.
All right. So if people are trying to stay active, but they're also trying to protect their knees and their joints, what are some of these new innovations?
Yeah, so really, a lot of times people will look for that secret sauce.
Yes.
And there's not one. The main thing is staying active, doing things that are not causing you injury. And so a lot of people are able to go out and run marathons. They're doing Ironman triathlons, and they're doing great. They're doing CrossFit. They're lifting heavy weights. Other people get out and try to run a 5K and their knee swells up. So it really depends on you, your situation. But I encourage you to maximize your activity that does not cause damage. And working with your physical therapist, with your physician, over time it can help schedule a specific regimen for you.
And I love that advice, and it is really about developing those relationships. Virginia is on the line, and she has a question for Dr. Shane Barton.
Sure.
Did we lose Virginia?
Yeah.
Hi there. Good morning.
Good morning. I live out of Shreveport.
Oh, great. What's your question for the doctor when it comes to shoulders, knees, joints, things like that?
Well, does he know what causes neuropathy? I went to a doctor and he stuck needles in my leg. And that's it, said I had neuropathy. Both of my feet feel like they're asleep all the time. Like they're asleep and won't get back normal.
Well, no, that's not normal. I mean, I will tell you, it's not uncommon either. It's something that, as an orthopedic surgeon, we'll see a lot. Primary care physicians, up to 40% of visits to a family medicine physician relate to some sort of musculoskeletal complaint, and nerve-related complaints are often one of them. There are a lot of causes of neuropathy, and obviously, not knowing your case, I can't make specific recommendations, but some people can have injuries to the spine that can compress nerves, that can cause some of the numbness and tingling that you're describing. Other people can have conditions like diabetes, and if diabetes is particularly if it's not controlled well, can cause degenerative changes to the actual structure of the nerve itself, which can lead to permanent nerve damage. So certainly identifying the cause of your neuropathy, I think, is very important, because there are things that can maybe not cure it, but at least prevent it from progressing.
And when you're talking about neuropathy, and I have firsthand experience with that with a family member, I mean, that can then lead to unfortunate joint injuries.
Absolutely.
Later on.
One of the biggest things we see in populations that have a prevalence of diabetes is peripheral vascular disease. And so what will happen, there's not good blood flow. They don't have the ability to heal wounds well because of the blood flow. and they don't have the sensation intact to be able to prevent the injuries. So you'll get an open sore and never know it. And by the time you realize it, sometimes it progresses to the point of needing significant interventions up to and including amputation.
Oh dear, oh dear. Well, let's talk about, that is probably the most drastic thing you would ever have to deal with. Let's talk about some minimally invasive surgeries, because it seems like orthopedics has really advanced and advanced and advanced. And tell us about how minimally invasive or arthroscopic surgery has changed and developed and modernized over the years.
Well, yeah, we can use two of the things we've been talking about. We've talked about rotator cuff surgery. It used to be done through very large open muscle splitting incisions where we would have to go through multiple layers of muscle, and it was a big surgery to operate in a small area. And so the recovery, and I still see this all the time, patients will come in and say, Dr. Barton, I've heard shoulder surgery is the worst thing in the world. And I say, you know, with the changes, it's still not fun for people to have to go through and have a rotator cuff surgery done. But if we're able to do those surgeries now through 3 or 4 small holes just big enough to put a pencil into, okay? But we're able to do all that surgery. At least that limits the unnecessary damage to the shoulder. Same thing happens in the knee with an ACL. It used to be a huge open surgery.
Yes.
If the meniscus was torn, we'd take the whole meniscus out. That would obviously lead to degenerative changes later, arthritis. And so now through small incisions, we're able to rebuild multiple ligaments in the knee if they're injured, trim out or even repair the meniscus to try to save as much of the pad in the knee as possible.
Has the chance of infection gone down?
Yeah, you know, yes, it has. A lot of it has to do with, you know, it's very rare for there to be an infection in the operating room from contaminated instruments. A lot of times what it may involve is the patient's their own kind of immune system, their overall health. It can involve their nutritional status, those kind of things. The risk of an infection, let's say at the trauma center, when someone comes in and they have what we call an open fracture, the bone's sticking out of the skin, you know, obviously those risks go up. Even if you do everything the best you can, there's a risk of infection. The good thing about it is our antibiotics can be more tailored specifically. Our ability to treat infections has improved tremendously. At the same time, the bacteria have altered their genetics, and so they become resistant to some of these. So we're very careful about our use of antibiotics and surgery.
I tell my daughter all the time, I tell her, do not fail to take the antibiotics exactly as prescribed.
That's right.
Because you can develop that resistance. Again, our phone lines are open. We want to thank Virginia, who called in with that important question that I think affects a lot of people in the Shreveport-Bossier area. Again, our phone line is open. It's 318-219-4569, and you can bring your questions for Dr. Shane Barton. I mean, where else can you talk to a doctor without having to go to the office and pretty much very easily? So let's talk about this, Doctor. What are the top 3 things that people can do to keep on top of their joint health for the future?
Well, we talked about, you know, 3 things that are pretty straightforward. Stay active, watch your weight, work on your strength. But I would add into those things, be aware that, you know, a lot of people don't want to go to the doctor because, man, I don't want to have surgery. I'm not going in, even though this hurts. I think if you find the right team that will take care of you, I always tell my patients, I have never taken someone to the operating room that didn't want to go. Okay, so if people come in, even if I recommend, look, this is something I think would be better with surgery, and they're like, I'm not having surgery. Okay, then what can we do to manage your pain as best as possible? I think being afraid to go in and talk and discover is a little misguided. Yeah. So, you know, come in early if you're having an injury or a pain that's not going away after.
Don't put it off.
Yeah, don't put it off if it's limiting your ability to do the things you want to do.
Right. Well, we've been getting some great answers from Dr. Shane Barton with Willis Knighton Orthopaedics and Sports Medicine here on KTBS 3's Healthline 3. What are some of the newest advances, Dr. Barton, when you're talking about your field? It seems like there's a lot that's happening. We were talking about just the way surgery is developed.
Sure. I mean, the big things for us now, obviously, people that talk about orthopedic surgery using robotics. Robotics is something that's making a large impact on our ability to be very precise. understand when
So
we...
you're not implanting robots in us?
No robot
You're just using
implantation.
it helpfully in the surgery.
Correct, and there's different ways, like our general surgery colleagues or our neurosurgery colleagues will use a robot, urology. They won't even be scrubbed in. They'll be at a control station. Now, we still don't do that in orthopedics routinely, okay? But what we will do is use a saw. Let's say if we're doing a knee replacement, we have to saw away some of the old bad bone. We can use that robot that has mapped out that patient's anatomy to actually be able to very precisely make those cuts, okay? And
it can measure the distance, and the angles,
absolutely,
and everything.
and you can plan everything pre-operatively so the patient, you know exactly what size implants. It's been a great benefit, but you have to realize the outcomes are not significantly different yet, okay? Meaning that doctors that are well trained in doing it without robotics do just as good a job with the joint replacement. Although the degrees may be off just a tiny bit, the functional outcomes are equal right now.
Okay.
I will say Johns Hopkins is working on a robot that has what is called it's AGI. It's a artificial intelligence where it is autonomous and it can actually do surgery. They recently did a cholecystectomy, which is removal of a gallbladder from a pig, with absolutely no human intervention. So started, made incisions, went in, dissected under fluoroscopy, or what we call laparoscopy, looking with a camera, with no human intervention, was able to successfully do that. You know, we're not
there yet.
We're not there yet, but these are the kind of things that we're working on. Another technology, obviously, is some of our implant design, more specific, that matches that patient's anatomy better. Let's say a hip replacement, a knee replacement, shoulder replacements, which is one of the main surgeries I do. And you know, the advances in that technology over the last 20 years have really been just tremendous.
And the material used too. I mean, that's advanced a lot too.
Correct. It used to not be uncommon. You know, I tell people right now, if you have a well-done shoulder replacement, new ball and socket, that the chance of that implant surviving at 20 years, meaning 20 years down the road, you're still functioning fine, is close to 90%.
Wow.
And so that is a testament to new materials and things and better designed implants.
Because it used to be that people would have to get them replaced like at 20 years, 30 years?
Or even at 8 or 10 years, you might wear out some of the components, have to have an additional surgery to replace those. Those components are lasting a lot longer now.
That's a tough on the body, especially as you age.
And I always tell people
surgeries.
revision surgery is never easy. So if you're going, there's nothing like getting it right the first time.
Yes.
And if you have to go back in a second time, the risk of infections and complications, even though people can do great, it's still a bit higher.
Okay.
Yeah.
But as someone who has a spouse who had knee replacement, double knee replacement, there is nothing better than the gift of being able to walk without pain. So that is something that you are delivering to your patients as well. Let's move on and talk about this. When you talk about the weight and fitness, and we talked about this, we touched on this earlier, and how losing weight is something that people can do. It is a difficult topic to tackle, but at the same time, you see directly how that affects joints.
Absolutely. You know, we know, so let's say older women. When I say older, we're talking about people that get into their late 50s, 60s, 70s. The stage of age, I'm in my late 50s as well, you know, people will start to develop, especially women, osteoporosis or osteopenia. That's the bone, the material of the bone is still good, but there's just less volume of it. It's not as thick and strong as it used to be. Well, we know from just years of experience, including space-based experience, that resistance exercises, things that maintain your strength, also help maintain your bone health. And so for older people especially, I think that's something over the last 10 years that we've really pushed a little more. But you also have to understand that rope in their shoulder, the rotator cuff, is also weaker. And so if you start putting too much weight, you increase the risk of injury. That's why it's critical that you get into a good program, a good gym, a good strength and conditioning coach or physical therapist to really help you develop a unique program for you.
Water aerobics, that's something that's
Water aerobics,
good.
swimming, biking, just being out and walking, all those things are very good because they're low impact on the joints.
All right. We're coming up into our final couple of minutes, and I know we want to ask what you think patients should look for when they're looking for orthopedic surgeons. But before we get to that, is there anything that we haven't covered that you would like the audience to know?
Yeah, one of the most common questions I get, I take care of a lot of high school, collegiate, and weekend warrior athletes, okay? And a lot of people are really more and more aware of things like stem cell treatment, something called PRP, platelet-rich plasma, something called BPC 157. This is something that's out there. It's a body protective compound. So what I want people to understand, there are some things that we know are proven to be very helpful with injury. But there are other things that are very promising, but not proven yet. And so here's an example, the peptide therapy, insulin. We know insulin helps with diabetes. It's a life-saving drug. It's a peptide. We know peptides are effective. The glucagon-like peptide 1, GLP-1, that's what all these weight loss medicines are. Obviously, tremendous impact on the need for orthopedic surgery. People who previously would come and say, I've got to have something done, my knee's killing me, there's been a 40% reduction in the last 3 years, 40% reduction over the same population. When someone come in, used to say, I need surgery, to now saying, I don't need surgery.
Wow.
40% for knee injury specifically. And there's, these.
So is it a side effect of the GLP-1, or is it the fact that there's less weight being carried on the joint?
Well, it can be a little bit of both. The GLP-1s affect blood sugar regulation, they affect appetite, but I think ultimately we believe that it's mostly going to be a weight loss type thing. It's also affected positively cardiovascular health. So I encourage people, if you're struggling with the weight problem, still the bedrock is your diet and your exercise. But if you're struggling for years and years and your body is beginning to show signs of wear and tear because of excessive weight, that's one of the biggest things you should do, whatever you need to do to try to get that weight under control, working with your primary care physician.
Okay, so that's step one.
Yeah.
So we talked about the primary care physician. Let's talk about choosing an orthopedic surgeon in our final couple of minutes here.
Yeah, I think, and we've touched on it already a little bit, I think it's choosing someone that you develop a relationship with. One of the things that, and look, I have trained orthopedic surgery residents now for 22 years. I get to work with some of my colleagues in the community now that are absolutely fantastic orthopedic docs. And the thing that makes them good certainly is their hands, but more importantly is their ability to sit down and listen and talk to the patient. We as surgeons like to be in the operating room, but as orthopedic surgeons, we also like to be in the clinic, on the sideline, helping people be active. And I think you need to find a doctor that you trust. That doctor, not only that physician, but also the support team, the nurse, the front office staff. You need to be able to call and get through and be able to communicate. And it really will build rapport and trust between the physician and the patient. And I think that's as important, if not sometimes more important, than actually the surgical skill of the surgeon.
Well, there you have it. Audience, it was wonderful listening to Dr. Shane Barton talk to us about joint health and how to live a healthier life and be nicer to our joints, and what to do if you start to run into problems. As he said, there is pain that there is no gain from. So make sure that you're paying attention to your body. Make sure you find the right orthopedic surgeon, and that you develop that important relationship with your primary care physician so that you can decide whether or not you need to consult one of their experts who can give you that consult. So Dr. Shane Barton, thank you for joining us from Willis Knighton Orthopaedics and Sports Medicine. We thank you for watching, and Virginia for calling in with your important question about the people who are dealing with not only joint pain, but also that very difficult nerve tenderness that you get with certain conditions. So thank you for watching this Healthline 3. I'm Shannon Brenius. Have a great day, everyone.